Okay, so before we begin, I'd like to acknowledge the traditional custodians of the lands on which we're all joining from today. We pay our respects to elders past and present and extend that respect to any Aboriginal and Torres Strait Islander people joining this webinar today. We acknowledge their continuing connection to land, waters, and community. Um, my name's Bree, and I'm joining today from the lands of the Murrumarang people on Yuin Nation. If you do know what lands you're joining from, I do encourage you to share that in the chat. So, welcome back to the Genetics webinar series, which is a collaboration between Belongside Families and the Genetic Alliance Australia. If you're joining for the first time today, welcome. In our previous session, we explored those first steps of wondering, could it be genetic, and navigating that initial testing process. Today, we're moving on to what happens next when the results come back. For those who've been on this journey, you know that waiting for results can feel endless. And then suddenly you're holding a report that might as well be written in another language. So, whether your results were what you expected, completely surprising, or somewhere frustratingly in between, today is about making sense of what comes next. And I guess for those joining us today, perhaps you've recently received some genetic testing results and you're trying to understand what they mean for your child. Maybe you're preparing for results that are still to come. Either way, you're in the right place. Today, we're joined by Dr. Alan Ma, a clinical geneticist who speaks genetics as fluently as we speak everyday language. And please feel free to correct me on any of my language throughout this session, Alan. And we've got Maya Pin, a parent who has navigated the emotional roller coaster of receiving results and what follows. Together, they're going to help translate the technical info into the practical and the overwhelming into hopefully the manageable. And I'm also delighted today to have Emma again, Chief Executive Officer of the Genetic Alliance Australia. As I said, Emma will be monitoring the chat and the Q&A throughout our session, helping to ensure we address your questions and connect you with the additional resources as needed. So, before we delve into these questions, I'm going to hand you over first to Dr. Ma, who is just going to provide, I guess, some context and information to help set the scene for our discussion today, because there is a lot of information we need to cover.
Thanks, Bree, and thanks so much for inviting me to join this great group to present this this topic. So I'm going to talk a little bit about genetics, and try to kind of break down a bit about what we're talking about with genetic testing. So I guess firstly, I wanted to cover that genetic testing can actually come in lots of different types and forms. And usually for families, the most common way these are done is to try and find a diagnosis in a child or a person where there have been concerns, often about things like neurodevelopment or physical differences that might point towards a genetic diagnosis. So I guess you've probably covered some of these in the first talk, but I'll briefly cover the different types of reasons for testing and also the types of testing that can be done. Often it's done because of a combination of a bit of those physical, maybe appearance issues or medical issues that have come up. So sometimes multiple organs might be affected in an individual, like the heart or the kidneys or the brain, and also those neurodevelopmental clues that we mentioned before. So in terms of the types of forms of genetic testing that we can have, really, I'll start from the most basic kind of screening level, that usually the first level of testing is to test the chromosomes. So these are kind of the structures that make up our genetic makeup, and it screens for things like Down syndrome, which is probably the commonest chromosomal condition out there, but also other differences in the chromosomes that might be small deletions or small extra bits or duplications of these chromosomes. This type of testing has a pretty low yield, probably about 10 to 15% of the time it'll find an answer in a child where these questions have been raised. And so that leads us to more detailed testing, which we often call genomic testing or more detailed gene testing. And these can be in the shape of other types of tests. I'm going to use a bit of jargon here, but the two commonest forms are exome sequencing or genome sequencing. And these are done sometimes in an individual, sometimes done in a child with both parents' DNA as well. And these tests find an answer probably about 30 to 40% of the time, depending on the reason for the testing. So apart from, obviously wanting to find an answer for a child or an individual where there's a question about a genetic diagnosis, there's also several other possible outcomes of testing. So like I said, 30, 40% of the time we'll find a genetic diagnosis. About 50% or even more of the time, we actually don't find a genetic diagnosis. And we often call this an uninformative result, where based on current technology and our ability to look at these genes, we just haven't found an answer. About 10% of the time, we might find a result called a variant of uncertain significance, and we'll talk a bit more about this later. But this can often be in that gray zone, which is hard to interpret. About 1% of the time, so pretty rarely, we find something called an incidental finding. This is kind of something a bit out of the blue, something that's in an unrelated condition or an unrelated gene for the original reason for testing. So the commonest type is, if we're investigating a child for neurodevelopmental problems, but we find a change in a cancer gene, like a breast cancer gene, that's kind of pretty unexpected, but potentially might have important implications for the family. So I guess, yeah, there's a few possibilities there. I guess the final thing I did want to say was something a little bit about language. I think it's really important. We're quite careful in genetics to use language that's quite neutral and doesn't put values or labels on things such as genetics and results. So in the past, we used to say, that someone carried a mutation or a mutant gene. We really don't try not to use that language anymore. We usually use the word variant. So variant's kind of useful as well because it kind of normalizes genetics. We all have variants in all our genes. It's what gives us our eye color, our hair color, makes us taller or shorter than our siblings. So really, we're just trying to find the variant that's responsible in an individual for their condition, but we all have these variants. We also try to say that a variant is either pathogenic or causative, rather than using terms like positive or negative, because it's quite tricky when we talk to families. We're saying, oh, we've got a positive result. Does that mean it's a good thing or a bad thing? And what I think might be positive might be different from what the family thinks is positive or negative. So we try to just say, pathogenic or causative. We'll include some notes in the show notes, but there's some links to some papers that we've written. They're quite technical because they're aimed at pediatricians, but they really talk a lot about how these different results can come out from genetic testing, and also what pediatricians can order now with a new Medicare item, where they can actually order a lot of this genomic testing in conjunction with geneticists. This is a new kind of change that's happening now called mainstreaming, where more and more non-genetics healthcare professionals are able to order and find genetic diagnoses themselves.
Amazing. Thank you so much for that overview. I know for many families receiving results, especially when they include terms like variant of uncertain significance, that can feel really overwhelming. So I'm really excited about this conversation that we're going to have around what families really need to know. And Alan, I'm going to come back to you first up as well, because I want you to just walk us through what different results mean. Whether it's genetic cause identified or not, those variants of uncertain significance, like how should families prepare for these possibilities?
Yeah, that's a really good question. And we try to cover this whenever we go through consent. So with genomic testing, every family will go through a consent process where we really discuss these possible outcomes. Sometimes that's done 6 months before you get the results. So you might not even remember what was said at the original consent. So when we talk about a diagnostic result or a causative variant, basically what we're saying is that we think this is the diagnosis for you or your child. We think that this gene and a pathogenic change in this gene has led to a genetic condition. Sometimes these conditions could be associated with, just one organ or a single thing being affected. Sometimes it could be what we call a syndrome, where lots of different organs, sometimes development can be affected as well. And it gives an answer for a family. I think the biggest implication for this result is that it provides a diagnosis, but also B, a bit of closure for a family as well. often the families we see have had a really long diagnostic journey. It could be 5 years, 8 years, 10 years or more. And so it provides the closure for that journey to say, look, this is what we think is the answer. This is what we're considering as the diagnosis, and also helps to move on to think about management and how do we look after this individual or child. Possibly could access a community of support as well, especially for diagnoses that might not be super rare. There might be other families, there might be a family support group. And also it helps that family to clarify, how has this come about? Is this genetic change new? Is it something that might happen again in another child or other siblings? And so it helps to clarify that whole story for a family. So that's what you get with the diagnosis. I guess the tricky thing is that sometimes the opposite is true when you don't get a diagnosis. So for an uninformative result, this can actually be really difficult for some families because it doesn't bring closure. It doesn't bring a clear answer. It doesn't clarify the recurrence or the inheritance of that condition. But on the flip side, for some families, a negative or an uninformative result can actually be reassuring in some ways. For example, some families are seeking that reassurance, thinking, okay, we've excluded a whole bunch of some pretty serious conditions, and so we haven't found anything in them. Maybe there isn't a genetic diagnosis, or maybe it's something else. So for some families it can be reassuring, but for some families it can actually be very difficult. For the variants of uncertain significance that I mentioned before, this is probably the number one cause of a lot of uncertainty and anxiety, because basically we're telling families we think we found something, we're not sure if it's the answer or not. It might be something totally benign that's not really the answer at all, or it might be a clue towards something that could potentially be the answer, and we just do not know. So what we're saying is we found something, but we don't know what it means, and so that can be really difficult information for families. It's unhelpful because it doesn't help guide us on how to manage that individual, on how likely is this to happen again in a family, and it just puts them in that gray zone where we're just kind of not sure, and it can be quite uncomfortable because we haven't got an answer, and it doesn't provide any reassurance at all. I guess the tricky thing is that a lot of times these variants of uncertain significance get reclassified over time. So we can talk about that a bit later, but it might end up being the diagnosis or not. And so we hopefully will still provide some closure, but it might take a bit more time than initially thought.
Yeah, yeah. It sounds like such a roller coaster of emotion, like either journey. Like it sounds like there's relief, but then yeah, that uncertainty and that overwhelming. Um, Maya, I want to ask you, can you describe what it was like when you first received your son's genetic testing results? Like, how did you prepare yourself mentally, and what do you wish you'd known beforehand?
Firstly, thank you for having me here. And just a bit of context for those listening, my son is 8 and has a diagnosis now. So, as Dr. Ma said, we got the testing done in June. We didn't get results until December. So that was a very anxious waiting game, I suppose. So I tried not to think about it too much when we got the testing done. Although I did a lot of research. I'm really into sort of science and research generally. And so I had briefly researched quite a lot of the different gene variants and syndromes that could possibly be found, and sort of matching those to my son's features as such. And at the time, he didn't have any like organ specific, like no heart condition, didn't have epilepsy that we knew of at the time. So that was also very hard, but he had a severe global developmental delay. So I was hoping something would come up in the test. We did whole exome sequencing. And as Dr. Ma said before, you can either have just the child done, both parents and the child, or one of the parents. At the time, it was just a single, which just means my son was tested. And that's just kind of how it was at that point in time. And then when we went in for the appointment in December, you don't get told whether you have a result or not, or like a causative finding. So I kind of went in with, we're going to get a diagnosis or we're not, or we're going to be in that grey area. And we were in a weird position when we went in. So when we went in, I was also about 28 weeks pregnant, just coincidentally, just kind of obviously was very early pregnant during testing at the start and I didn't know. And I went in by myself, which I wish I had known not to go in by myself. That was definitely one of the takeaways. And we got a diagnosis. However, it was a VUS, so a variant of unknown significance. And that was predominantly because it was a single testing. So I wasn't tested at the same time. And because this specific gene, it's called IQ2, is on the X chromosome, that means only mum can pass that on for a boy, because a boy has an X and a Y. So then I got a mouth swab during that appointment, and then I had to wait again to see if I was a carrier. As some people might know from previous session and so on, you can be a carrier and not have any symptoms or the condition yourself, but could pass it on. So also being pregnant, I was terrified, as my son's condition was quite severe. So he couldn't walk, crawl, super cute and adorable, but had a lot of different delays. So it was quite challenging, but it was very hard to sit in that appointment. I think I let most of it out when I was in the car on the way home. It's a nice hour drive from the hospital. So that's why I kind of wish I had someone else with me at the time. And then I had to go home and tell my husband what I kind of had found out about Lloyd. And even then it was this is possibly the answer. We're not too sure. So whilst I did a lot of preparation beforehand, which you don't have to do, I coincidentally found a family that had been diagnosed with that a month prior. So I had also already kind of, again, just coincidentally, researched a bit on that condition. So I feel like that helped a bit, but the prognosis isn't fantastic, which still scares me today, but you do sort of work through that. And I guess you don't know what to expect when you go in for results. So you kind of have to go in expecting not to have a diagnosis and maybe having a diagnosis. So I think going in with a mindset being like, this could possibly find us an answer, but it's not the end of the road if you don't. So you can go into research projects or further testing. And I think that's super important to remember, and that a diagnosis isn't everything. So whilst we got a VUS, and I had the mouth swab, so we had further testing, and then we had further testing even further down the line, thanks to a research project. I think you're allowed to be upset. You're allowed to be overwhelmed, but don't do it by yourself. Even if it's someone that doesn't understand, until you find the tribe that all do understand. Like I said, I cried on the way home. And so then I guess I felt a bit relieved when I got home to be able to talk about it. And it took me quite a while to really settle, but you really go through a bit of a grieving process. So I think that's absolutely okay. And I tell people you really have to go through those stages. It's just the same as if you want your child to be the next best football player and all of a sudden they're into singing and guitar. Whilst that's very different circumstance, you go, okay, well, that's my child, that's what they want to do. And when you've got a child with a genetic condition, that's just the way it is, but they can shine in their own way. So I think trying to think of something positive, but you don't have to think of something positive at the beginning. Just try and get through every day. Just try and cuddle your child and get through as best you can until you can really think about it and sort of delve into that grieving stages, and then it becomes happier from there.
Yeah. We talk about grief a lot at Alongside Families, and we talk about it's that grief around what you thought your parenting role was going to be. So it's not that, your child has this genetic condition or a disability. It's just, this is not what I envisaged my parenting role to look like. And it does take time to adapt to that. Now, you've both just recently, in what you've said, mentioned, this gray zone, so that uncertainty. So I want to come back to you, Dr. Ma, just to help us understand VUSs, did I get that right? Results, so variants of uncertain significance. Like, how common are they, and what should families expect over time?
Yeah, so um, we think that they happen probably about 10% of the time. Now, that that's in 2025. Probably that number will reduce over time. And part of the difficulty is it's basically telling us that the science hasn't caught up with understanding what this is. That we think it could be part of the answer, but we just do not know yet. And that's because a lot of the genomic testing that we're talking about, that really is kind of the cutting edge of what science is able to do. So that is, 10 years ago, it didn't even exist. And so a lot of this testing is really trying to push, technology and our understanding of genes. So one of the biggest things that will probably help with clarifying whether the VUS is part of the answer or not is unfortunately time. Time for sometimes the science to catch up. So there might be a lab or a group overseas that is looking at that very gene or that very variant, you just don't know, and might publish on that, tomorrow or next week or in a few months' time. That happens all the time at the moment. There might also be a lab that's able to offer research testing to your family. So that might be an option as well. Part of the difficulty is research testing is slow as well. It could take months, could take years before they really help to clarify that. Sometimes testing the rest of the family can be helpful to try and clarify, especially if we found this variant in another individual who was either affected or unaffected, it might help to sway us one way or the other to work out whether it's part of the answer or not. But unfortunately, it is really time for the research and the science to catch up so that we can understand this better. And that could be months or years, unfortunately. And that does cause a lot of anxiety and worry in families, totally understandably.
It sounds like patience is very important throughout this journey. Your testing journey involved lots of stages. How did you cope with the uncertainty in your results, and what helped you manage with the not knowing?
So I guess firstly, the emotional challenge. We all know what it's like to wait for something, especially for 6 months, and then to have a possible like, oh, this is probably what it is, and then you've got to wait longer. It's very annoying, but also very anxiety provoking. And you don't want to think the worst case scenario, but you don't want to be completely naive and think it's nothing. And maybe maybe it's just something small, which I definitely was at the start. I was hoping it was some little thing that was going on. To be honest, it is a small gene and a small gene variant. So I was kind of right, but it caused a big impact. So the emotional challenge was really trying to not, I guess, Google about every two things. And you feel really isolated because when you first step into this undiagnosed or rare genetic realm and journey, you don't generally know anyone else going through the same thing. So you feel really isolated. You don't know who to talk to, especially if you don't know much about science and genes. It's all very confusing. Even for someone that's quite into that space, I've learned a lot. And, you can only learn so much, particularly while you're also raising a child, going through this anxiety-provoking situation, and possibly working and whatever else as well. And your family might be trying to give you some empathy and trying to help you, but no one else is going through that. So I think going on to the strategies of dealing with that is trying to find your tribe or trying to find at least a couple of people that are going through that. And you might be able to talk to your GP about it, or your maternal child health nurse, or your geneticist, or your pediatrician, neurologist, whoever you've got, because they generally have some kind of group they can refer you to. And for example, I found Swan Australia. I think it was sort of Google search. And then I found their Facebook group. And that really helped me, particularly with sort of the jargon of the testing. So I could type in even anonymously and be like, we're having whole exome sequencing. Have you done this? What was your result? And people are pretty happy to share, especially in a closed Facebook group. And that really helped me. I mean, you hear from one spectrum to the other, the devastating results to we got this result or we didn't get this result, but this is how we're going. This is what our child's like. And I guess I was lucky to find a family or a couple of families that had children with similar global developmental delay, and we're doing similar therapies in similar sort of area. I'm in Victoria. And so that really helped me deal with not knowing, and it kind of took my head out of just sitting on Google at 2 a.m. for a couple of hours, which really doesn't help. It can help a little bit, but really just trying to find some people you can talk to, especially not just your clinicians, because they can't be there all the time. So someone else that's up at 2 a.m. with you while your child's not sleeping, or you can't sleep because you're too worried. Just don't settle into this anxiety, because it will really kind of drag your mental health down, and you want to be there for your child. So
and there is so much validation in that lived experience of other families that have felt the emotional roller coaster that that you're going through and can actually say, we've been there, like we get it. Um, Dr. Ma, you talked a little bit before about just, genetic testing, it's changing. How quickly is it changing? And what does this mean for families that might have older results?
Yeah, that's a great question. I mean, when I started training 1.5 decades ago, most of the testing that we do now wasn't even available. It didn't even exist. And so things have changed, especially over the last decade, so rapidly. And what standard testing now would have only you couldn't have even dreamed about it several years ago. So the testing itself, the technology is improving every year. The availability is improving as well, and the cost is coming down. And so the exome sequencing that Maya talked about, yeah, that's rapidly transforming into genome sequencing, which is 50 times bigger, and there's more data, and it covers more genes in a better way. So that's happening all the time. We are suggesting at the moment that if you have an uninformative result or a VUS, to really think about reanalyzing that data and re-looking about every 1 to 2 years. We think that after about 1 or 2 years, you actually get like an uplift in our diagnostic rate of about 10%, just due to the improved technology and also our improved ability to understand these genes. So new genes are being discovered all the time and being published pretty much every day. There's a new gene that's being discovered. I guess the new changes in technology are improving those diagnostic rates, but also there are, as you mentioned, a whole cohort of patients who probably missed this. They were originally tested in the pediatric system maybe a decade or two ago, and are now in the adult system, and they might not have a geneticist, or that they definitely won't have a pediatrician anymore. So for those families, we're actually recommending that they go through their GP and get referred to genetics for consideration of a diagnosis, because we're actually finding a lot of diagnoses in undiagnosed adults. Those tests are now available for adults as well.
Yeah, it's incredible how much it's changed, and how much it is constantly changing. It must be exciting to sit in that space and watching that development happen so quickly. Um, let's talk a little bit now around, trying to get that clear information and, what are your rights? So I'm going to come back to you again here, Alan, but, people receive their results in many different settings. Um, what if you've received your results, but you don't fully understand them? What are your rights to get that clear information and genetic counseling?
Yeah, that's a great question. I think I mentioned earlier before that mainstreaming is happening more and more, that actually non-genetics clinicians, GPs, pediatricians, neurologists, oncologists, pretty much every area of medicine, they're ordering their own genetic testing and getting results. I guess one of the difficulties in this phase is that in our genetic services, we have genetic counselors and lab geneticists and clinical geneticists. We're trained to help families really understand and grapple with their results. We help, we provide counseling. We really help them to deal with the implications of these results. Sometimes we even provide like plain language or lay language reports as well for families, and write reports in simpler language so that it's not just full of medical jargon, so that it helps practically with families, and also when you're talking to your GP or your allied health professionals and schools as well. So a lot of that is done through genetic services. A lot of that might not be available through mainstream services, for example, your GP or your neurologist or pediatrician, because they haven't really been specifically trained to deal with this and to help families understand this. So I think my first advice would be that if you need more information or support around a genetic result, reach out to your local genetic service. So there is a local genetic service for every area in Australia. And that service has been set up specifically to help families understand a result and to kind of grapple with this. There are also private genetic services available outside the public system, and increasingly available around Australia with telehealth as well. So that's also an option for the families as well. And also there's increasingly numbers of patient support groups like Genetic Alliance and SWAN. They are actually really, really important, because families can talk to someone else with lived experience or someone who really understands that journey and can also point them towards the right services to help them. So I think increasingly there are more and more supports and services out there. Part of the difficulty, and that's probably what Maya mentioned before, is, you know, if you Google this, you might find the right one, you might not. So it can be tricky, and I think I'll try and include a link for you to a service called the Genetic Service Finder, where you can actually type in your suburb or postcode and find where your local service is and get a GP referral.
Yeah, absolutely. And we'll make sure we include that in the follow-up email as well. Maya, I want to come back to you now. Have you had to advocate to get clearer information or maybe push those referrals along the way? And you know what's actually worked in your experience?
Yes, so I have had to advocate a lot. At the start, I didn't really understand that I was advocating. I thought I was just, being a good parent to my son, as most of us, I think, we just think, we're doing the right thing as a parent, but you really are advocating. I had to advocate quite hard, being that I was 18 when I had my son, and we noticed things sort of around 4 to 6 months, as he wasn't sort of developing as much in terms of grabbing toys, eating lumpy food, sitting up. But they were all quite not too concerning at that stage. And my first advocacy point was with our maternal child health nurse. And whilst she was beautiful and she was absolutely amazing, and she'd seen my niece a year before, I really had to advocate quite hard. And I basically went from her to the GP, back to a different maternal child health nurse, then to a pediatrician, advocated hard again. And then that pretty much led me to a dead end. And then I sort of looked at what next steps were for my son myself, because no one referred us to genetics or told us about further genetic testing, because our pediatrician did microarray testing, which is looking at the chromosomes, so that level, and everything came back clear. There was nothing, no variants or changes. So, but no one told us that we could see a geneticist. And when you think about genetics and DNA, you think of maybe like hereditary cancers and different things like that. You don't necessarily think about a really ultra rare genetic condition that, whilst everything's rare, it's not that rare. We all have different rare conditions. So, our children. So, it took a long time to really learn how to successfully advocate. I had to take my mum into a neurology appointment once because the neurologist just would not listen to me. I don't know if that's because I was a first-time parent or a young parent, but I definitely didn't feel very confident. And then I sort of worked out that if I researched more about the specialist, say if it was the genetics team or neurologist, I went in with sort of what I wanted to ask and what I wanted out of that appointment. So even seeing a geneticist for the first time, I researched what testing could be done at genetics, and then just researched very basic information about what that testing was and what could come out of that test. Now, you don't have to go to that specifics, but you can ask parents, okay, when you saw a geneticist, what they do? Did they take a blood test? Ours took photos and a blood test. And I knew that would be a possibility because I talked to other parents. So I think just trying to go in a bit more informed, because your GP or pediatrician might not be able to give you answers, or it might be a long time between getting that referral from your clinician and then actually seeing them. So you might not have thought to ask those questions. And then just seriously jotting down like, okay, well, neurologist, he has absent seizures. This is his gene variant. Is there a possibility of having different types of seizures? Should I be looking out for something? And you don't have to have something written down, but even one question I think can really guide a conversation and really help you feel a bit more confident, especially if you think about referring to another specialist from that specialist. And so specific things really helped was asking how they could help us, especially if you've got a diagnosis. So with the diagnosis, sort of, do you know about this condition? If it's really rare, they probably don't, which is totally fair. You can't know everything, but maybe asking for a clinician that might have a bit more of an idea about these specific conditions. Or I asked for letters, and at the RCH have a portal, which is really great. And the letters are good for NDIS, childcare, that kind of thing as well. But even just a summary, which a lot of people do now after the appointment, they'll just give you a summary. Then you can go back and look at it when maybe you're not overwhelmed and go and read through it, maybe Google some jargon if it is in there. I got our lab report, which was super, super important for me. And you are entitled to that, so you can get the lab report back. Again, very, very jargony, very, very scientific. But you can go through line by line with your clinician, or even using a dictionary to figure out some words, so you feel a bit more confident in what you understand. And that way, when you go into the next appointment, you can go, hey, is this what this means? Just for clarity. And just persisting with people telling you no. Parents know best. Everyone kept saying my son was fine, and he is 8 and he can't walk, can't talk, has a feeding tube, has epilepsy, and a severe intellectual disability. So when I was saying something was not quite right at 6 months, I wish people had listened. But just go with intuition, but also, yeah, try not to get too deep in that rabbit hole of like, there's something wrong. They're still your beautiful child. Still love them and care for them. But just ensure that, you are being listened to. And if you feel like you aren't being listened to, you are very much entitled to a second opinion. I have been privately a lot. I can't really afford that as a single parent, but to know that I've done the most I could, I did go and see private pediatrician, private neurologist, gastroenterologist, etc. And if you can do that, please do that, or even transferring hospitals. So we transferred from Monash to Royal Children's because I wanted a second opinion, and I'm very glad I did. Not anything about the hospitals, both brilliant hospitals, just getting that second opinion really assured me that I was doing everything I could for my child, and we didn't miss out on anything that could potentially be life-threatening at that stage.
Yeah. Your son is very lucky to have you in his corner. You're a very fierce advocate. Alan, Maya just mentioned like letters. So why is getting a clinical summary letter so critical, and what should families do with it?
Yeah, I think it is really helpful for families. I think the first thing is kind of what Maya said, is finding that team, the doctors, the nurses, the counselors who will take you seriously and listen to you. I think you can't replace that. And I'm hoping, well, I think in genetics we do that. We're under-resourced. That's one of the difficulties, but we really try to train our doctors, especially, to really listen to families, because that story is unfortunately too common. I guess the second thing is, when we see families and we talk them through a diagnosis, we know that in that 1 hour appointment or whatever, they're not going to remember 90% of what we said after we've mentioned the gene sometimes, or even the gene name. It's a lot. It's really overwhelming, and it's huge. So we try to summarize it as clearly as we can in a letter to the family. We often go through the report and explain all the jargon in the report as well. And we try to clarify what the diagnosis means, what it means for the rest of the families, because sometimes there are implications for brothers and sisters and cousins and other people, and also try to outline as clearly and as black and white as possible for things like NDIS. And we know how important that is, to try and say things like whether this is a lifelong condition, it's permanent condition, and whether therapies are needed to help to manage this. So we try to do all of that in a letter to try and provide that support for families. We often also provide information for family support groups as well. So you can call this group or that group to reach out. And we always try to leave at the bottom, that we know this is really big, that if you have questions or if you have issues with any of this, do call us back. And especially for some families where we feel they've really struggled to grapple with the diagnosis, we often call them a week later, or one of our counsellors will call them a week later, just to check in and see how all of that went, because it is often a very big moment for them, and it can be quite devastating as well for some families, especially if they're receiving a very serious diagnosis with a lot of implications.
Yeah. I want to move on a little bit now, just sort of beyond the diagnosis. So, Maya, sometimes a genetic diagnosis doesn't change medical management, but it can still have a significant impact. Can you talk how having a diagnosis made a difference to your family?
Yes. So even when we got the VUS, and then it was confirmed to be pathogenic after a research project as well, the biggest thing for me was it wasn't my fault. And I think a lot of families, particularly mothers, as you carry the baby, and me being such a young mum, I always felt like I did something wrong. Maybe I ate something wrong, or I worked quite hard, like 40+ hour weeks when I was pregnant. Maybe I didn't take enough prenatal. But you just go through all these very silly things, and they don't seem silly at the time, because you're like, maybe I didn't do this. Maybe I didn't do NIPT testing, which wouldn't have picked it up anyway. But I'm like, maybe this was this, or I didn't do this, or something silly. But again, you don't think it's silly at the time because you just think, you've done something wrong, or like, even though I had a really pretty standard pregnancy and birth and stuff, I was like, maybe something went wrong in that and they didn't pick something up. Maybe he didn't breathe for the first little bit because, it's all quite, everything's going on at once. So you can't really remember every single moment. You just remember the moment you hold your child. And I think it gave us something to sort of focus on in terms of, okay, well, this is a diagnosis now. Well, where do we go next? Like, that was just one part of the journey. And then it's like, okay, we had NDIS just prior. Now let's focus into trying to find more families like mine, whether if it's the same diagnosis or not. Where do we go from this? And he was 2.5 when he got diagnosis. So navigating childcare, and then it was going to be kinder, and then special needs kinder, and then now he's at a special school, which all seemed terrifying back then. But it was just like, do we focus on walking? Do we focus on talking? Which bit do we focus on next? So I think just having that diagnosis really helped us sort of guide us to where we could find our tribe and people, and what our life might look like in a positive way. And really feeling not alone was the huge impact. And then also family planning on top. So I found out I wasn't a carrier. So I was really pleased with that. So I knew my daughter would most likely not have the condition. And we're pretty sure she doesn't. I haven't had her tested personally. I just didn't want to, but she's developing absolutely fine. So I think that was another thing, that's why it was a bit of an awkward thing that I was already pregnant before I found out if I was a carrier or not. But I know that's a huge impact. And for other families navigating having other children, especially if they're a carrier.
Yeah. What ongoing relationship, Alan, should families have with genetic services? Like, you mentioned earlier about, people that might have had testing 10 years ago, like, to reconnect, like, what should that relationship look like?
Yeah, that's really that's really important, I think. So it depends a bit on the family. So some families we see and we give them a diagnosis and they just run with it. They're like, yep, okay, thank you. We'll and and that's fine, and that's great actually. So they end up, really owning it and just kind of going, yep, we need to do this, this, and this, and they might have a great pediatrician or a neurologist and they can follow up through there. So for some families, they don't really need a lot of follow up and support. For some families who have, especially those who have maybe a more complex result or might be pregnant or have other issues, we do offer ongoing counselling and support. So our genetic counsellors are really trained to look at those psychosocial aspects of a diagnosis, to notice when there are these concerns, and also to kind of preemptively act and help in that situation. So it could be anything from a follow-up phone call or another appointment with a genetic counselor to talk about it, or even a discussion with their GP to organize, formal psychological support and counseling, which some families do need. And I think it's very reasonable, because some of these diagnoses can be, can make a huge impact on families, or even the lack of a diagnosis or a variant of uncertain significance. So we really tailor it to each family and what they need. But for a lot of families, we often just say, touch base with us in a few years' time. There might be new research on this diagnosis, or a new test available, or new technology, or a reanalysis available. So we try to kind of bring that up. One thing that I forgot to mention earlier is, with the new technologies that keep changing, the kind of the hope that we have on the horizon is that therapies and clinical trials might come up. And that is happening in a few very rare situations, but increasingly. And so that's another reason to stay involved with genetics, to hopefully join a registry or to join a group where you can access these therapies and clinical trials when they become available. And I think it is just a matter of time before more and more of these become available. So I think that's really important. One of the difficulties that we have in genetics is that we think about maybe 2/3 or 3/4 of the families out there who are eligible for this Medicare ordered, pediatrician ordered genomic testing aren't actually accessing it. Our wait lists are blowing out to years and years. And so we have to do this kind of delicate balance where we really want to get new families diagnosed quickly, but also we want to provide ongoing support to all the families that we are already diagnosing, and also the undiagnosed and the ones with the variants of uncertain significance. So we're trying to juggle that kind of balance to kind of get things right so that we don't slow down the process so much that people aren't being able to access an actual test and a diagnosis. So it's tricky at the moment in genetics, but I think things are only going to get busier, and resources are going to have to be created to help families get a diagnosis, and more families, like people like Maya, are speaking up and saying, it's not good enough. We need more services, and we need better access. So I think there is a huge role here for advocacy, to keep pushing things forward, because without a diagnosis, these families won't be able to access those potential therapies that might be coming later on down the line.
It sounds just like an ever-evolving space at the moment, from, the testing, the support, as well as, yeah, all this new stuff that's coming from all over the world. Maya, I want to come back to you. You have mentioned about connecting with other families. How important has that been in your journey? And how did you find that reliable information in community? I know you've mentioned Swan, but yeah, I'd love to hear a little bit more on that.
Well, I truly value peer support so much that I used to be just a member of Swan and now I work at Swan. So I value peer support a lot, especially more so being a single mum, just in terms of I don't have that partner at home to sort of bounce things off. So one, value peer support, you can't even scale that. It reduces isolation, connects you to other families. They don't even have to be in the same state or country necessarily. Swan is Swan Australia, so ours is national. But I've met families with my son's condition internationally, not in person unfortunately yet, but sort of both realms are really helpful because Swan, there's lots of different conditions, over 500 different conditions, and then plus the undiagnosed population as well that we help. But I think it's really important to talk to different families that have gone through similar and different journeys, so you can kind of sort of chat about where maybe you haven't delved into, or give advice to those people navigating going through the diagnosis journey. And especially to families that are undiagnosed and haven't been told that they can be part of a research project, and they think it has to stop now and they need to wait 2 to 3 years, when most of the time they can join some kind of undiagnosed program, whether it's ID Now or something similar, and at least gives that family a bit of hope. Again, like Dr. Ma said, it depends on the family and where they sort of sit, if that's okay for them to sit in that space. But a lot of families want what's next. And I think that's really important that some people forget. And I think you're so busy in doctor's appointments trying to figure out the testing that was just done, and you don't think about the next steps. And that sort of comes to finding trustworthy information. We've talked about Googling, and please don't read things off Wikipedia. But
We're all guilty of it.
I did a Bachelor of Science, so we get taught how to properly research peer articles. But I think connecting with organisations like Alongside Families, even Genetic Alliance, Swan. I'm in Victoria, so it's ACD, Advocating for Children with Disability. That's a huge one down here. And they were definitely sort of my main point of call and support for just even accessing things, or requesting things like a companion card, a We Care card, going to the events like they have Dream Day down in Melbourne that all families with kids with disabilities get to go. And it's honestly like the best day ever. When you go to the zoo, usually, everyone's staring at Lloyd's wheelchair, and just because it's something unfamiliar to them, or someone might be having, generally when your child has a tantrum and everyone stares at you, at Coles or whatever. But when you go to like a disability specific event, everyone's like, oh, can I help you? Do you want me to grab something? Oh, Santa's over there. Are you okay? And it's just so beautiful. You really find this community that just are so happy to help. And so finding events, but information, and making sure it's trustworthy, because I think especially with parent groups, everyone has their own view of things, and you just want to be careful. You just want to sort of collate it all and get your own opinion about it. So I wouldn't necessarily take everything to heart either. And different states and different families and different conditions are all variable. So I think just trying to find your own truth in things as well. And just ensuring that the lived experience for someone else isn't necessarily how it's going to be for you. And there are very positive stories, there's very neutral stories, and there are very negative stories. So I think if you try and just naturally stick in that neutral to positive sector and try and think of the best thing that can happen, you won't be too disappointed if you're just aware of what could negatively happen. So yeah, just having awareness of the whole spectrum of things, which can be very, very, very hard.
Yeah, absolutely. Yeah, there is a lot of information out there, and it is hard to decipher through what's right for you and your family. But yeah, I think it is around as well trusting your instincts, because you do know your child best, and relying on your supports, and whether that is your medical team as well. We're coming sort of towards the end. I've got a couple more questions, but Alan, I want to know, what's the most important message you want families to take away about living with genetic test results?
Yeah, so I guess for families where they receive a genetic answer, I think we've heard from today, it's pretty clear how empowering and important that can be. I try to tell all my families that when we found a diagnosis, it doesn't limit your child. It doesn't really tell us exactly what they're going to be like in 5 years, 10 years, 20 years. And it is just one tiny variant amongst the billions of different bits of DNA in their DNA. It does not limit who they can be or become. And it doesn't change your beautiful child. So while getting a diagnosis can unlock a lot of things, you know, they're still your child, and this might just give a label or an answer to some parts of their life, but probably doesn't for most of the rest of their life, actually. And I guess the tricky thing is for families where they receive either an uninformative result or a variant of uncertain significance, life can be a lot trickier and a bit more confusing. I think the most important thing is to stay plugged in with your local genetic services, and don't be afraid to advocate and to ask those hard questions. What is the research available here? When will the therapies come out? When can you reanalyze the genomic results? I think those are the things that we are responsible for, and genetic services are set up to ally with families to help provide answers for those questions. So I think stay plugged into the services, stay plugged into people that you can trust and form a relationship with over time, to help hopefully one day to find some clarity and some answers in there as well.
Yeah, amazing. I saw Maya's face light up when you talked about, the child is more than the diagnosis, and they're going to go on to do these wonderful things in their own unique way. So, because she's already sort of said that sentiment throughout this. But Maya, my last question for you is, if you could go back to the day you received results, what would you tell yourself?
There's a lot I would say to myself. And I've thought about it a lot. But I guess it would be, you're allowed to be sad. And you will feel better. And I didn't believe that for a long time. And you don't believe that for a long time. And the person who actually helped me believe that was Heather Renton, who's the founder of Swan, because she said the first 5 years are a blur. And she's absolutely right. And it's not until I came out of that, just sort of in the last couple of years, that I'm like, I do feel a lot better now. Looking back, like even messages or photos or videos back 5 years ago, I was like, wow, like you really do change a lot, but it just takes time. And like Dr. Ma said, things take time, but really finding the people that can support you. I always try and focus on something positive. So back then I focused on like the genetics and science part and try and get myself a bit more like informed in that. But now it's like I get to pick the color of his wheelchair, which I was devastated that he was going to be in a wheelchair. And now I've got a 5-year-old that can run around, and she does enough running for both of them. So having a nice red, green, yellow chair is always fun, actually. And just picking little things to be fun and silly about, which might not seem fun and silly to everyone else, but even his feeding tube, its name's Peggy because it's a peg feeding tube. And so it just helps me feel a bit lighter about the things that are quite heavy, and just staying connected to those families that are around, but also just celebrating such small victories, or what you would consider small victories. So even Lloydie grabbing out to get his drink bottle at 7, I'm like, it's amazing. When he first learned how to grab his dummy like on a chain and just like feel down and get his dummy, it was almost the best day of my life, because he could put his dummy in his mouth, and it changes your whole perspective. So I think, if you get a diagnosis, just think about all the things you're going to learn, as time goes on, and that not everything is doom and gloom, even though it might sound like it.
Such beautiful words. Thank you both so much. The chat's been a little bit quiet today and there haven't been any questions, but I have seen you've added some resources in there. Did you want to speak to them before we wrap up for today?
Thank you. And I think Ellen and Maya, you've done an amazing job today. Thank you for sharing everything. And we do understand that sometimes questions can be really personal in nature. And it's okay if you don't want to ask questions on the chat or in the Q&A box. And you can follow up with Genetic Alliance via the email that is in the chat, support@geneticalliance.org.au. And we have an amazing, beautiful, compassionate genetic counsellor on our staff who does not replace the wonderful genetic services that Alan has been talking about, but can help meet you where you are at. And if you have questions about accessing or different pathways into more genetic counselling information support, or even understanding what resources are available, you are so welcome to contact us, and we can put you in touch with our genetic counsellor too. But please do not hesitate to share any of those questions, especially the ones if you don't feel confident asking them today.
Amazing. Thank you. Oh my gosh, we've almost kept to time. But yes, thank you so much, Alan. Thank you so much, Maya. And thank you everyone for joining us for the results are in the second session in our genetics webinar series. I really hope that Dr. Ma and Maya's guidance has helped clarify what genetic testing results really mean, and given you some tools to navigate whatever outcomes you might be facing. So remember, whether your results are clear-cut or uncertain, you have the right to ask questions, seek additional opinions, and take the time you need to process and plan. So looking ahead, our next session next week is on navigating daily life, and that shifts the focus to the practical side of living with a genetic diagnosis. So we have some special guest speakers who will share their expertise on working within systems like the NDIS and coordinating care across multiple services and making daily life work for your family. So I have actually just popped the link to that event in the chat if you haven't already registered. And this is often where families tell us they feel most overwhelmed, but we'll leave that session with practical strategies and hopefully the confidence to advocate effectively for their child. So yes, thank you everyone. Happy Tuesday. I hope everyone has a great week. I look forward to seeing everybody next time. And I think always remember that every step you make in understanding and advocating for your child matters. So thank you guys. It was great to see you all, and we'll see you for the next session next week.
Thank you. Thanks everybody.
Thank you.
Thanks.
Thanks. See ya.